Hi, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and I am thrilled to be joined with Dr. Sharon Parrish. Sharon, thank you for coming. Tell everybody what you do.
So I'm really glad to have the opportunity to talk to you about this important topic, so important to me and so important to all the women that I take care of. I'm internal medicine, women's health, menopause, and sexual medicine specialist. I live in New York City and I work at the Weill Cornell Medical College. I'm a professor there of medicine, and I focus on this area of my practice.
So for women who are watching, are women in their perimenopause, postmenopause, any period of time of life, somehow that discussion of sex, painful sex, whatever issues are, arousal, difficult to initiate as a patient, often get the message that my healthcare provider isn't asking, so probably there's nothing to do about it, and maybe this is just a normal part of aging and I should just go with it.
So that is the way women sort of feel in our society, because doctors and nurse practitioners and providers are busy, and they have a lot of priorities. So what I think women should know is, just because their clinician doesn't always bring it up, there are things that they can do, and it may be sometimes that they have to just get in there and ask about it. We're trying to teach clinicians to ask, but in the meantime, women should ask.
So that's the first important message I want you to sort of bold as a woman listening to this, that sometimes you need to advocate for yourself.
Oh, absolutely.
Following into this, you know, my healthcare provider didn't ask me, so it must mean there's nothing that could be done about it. And, you know, my blood pressure and cholesterol are really important. And, you know, maybe as the healthcare provider is hand on the doorknob, out the room, saying, oh, by the way, not a good approach.
No, so I think, first of all, women should know that there are changes in vaginal health, vulvar health, sex drive, arousal, orgasm through the menopausal transition and as women get older. These changes can be addressed with a medical, psychological evaluation.
Well, what type of changes? Like, what is it that may happen to me as a woman that I should actually bring in? Aside from, let's say, women commonly will talk about loss of drive or pain. Is there anything else that women should be aware of?
So women can, certainly through the menopause, through before menopause, during menopause, after menopause, the most common thing that I see is that women experience dryness and pain during sexual activity, whether it's intercourse or coital play, et cetera. And that may be related to the ability to get aroused and have orgasms. And that has to do with the hormonal changes in those tissues in that area of women's bodies. And due to those changes, these sexual function problems can occur. And we have a number of very, very good treatments, both things that you can buy in a drugstore and things that a clinician can prescribe to address it.
So if I'm a woman out there and I'm sort of nodding my head and saying, oh yeah, that's me, how do you empower yourself to put it on your agenda, to make it part of your healthcare provider's agenda, to drive that bus?
So as a general internist, I always encourage my patients to know that at the beginning of a visit, personally, I'm going to survey for things on their mind. But you can kind of supervise up or give feedback to your doctor by coming in with a good, solid, short list. And you put this on your list. You know, I'm here today, I'd like to talk about my health. I'm a middle-aged woman, a midlife woman. I want to talk about my health. One of the questions I have is changes with sexual activity. I want to bring up something I'm noticing. You know, start the conversation with your doctor. Teach your clinician that this is important to you. And, you know, hopefully you'll be able to initiate that dialogue.
So having the words to put it forward, I think it's a great tip. Write it down so that you don't get intimidated by the appointment and not bring it up, making it a priority. If you do bring it up and your response is welcomed and there's options offered, that's wonderful. If you're with a healthcare provider where you bring it up and it's validated but it doesn't seem to go any further, what options do women have?
Well, so one thing is to ask that clinician, you know, do you know anyone here or around who might be able to specialize in this? Or you don't want to say no more than you do, but you know, who specializes in this area, or who you can refer me to where I could spend more time to go into this in more depth. The North American Menopause Society has patient websites, has information on their website. There are other patient websites can I?
Yeah, any websites that you
Middlesex
recommend?
MD is an excellent website with lots of information.
So that's Middlesex?
Middlesex MD, the International Society for the Study of Women's Sexual Health, has patient information. So those are 3 examples where I refer patients to look at and learn.
I think what I'm hearing from you is that as a woman, it's important to be educated or empower yourself at least to bring the concerns that you have up to your healthcare provider, because that should be a first safe place of exploration.
Right, I think you should definitely feel empowered to bring it up. It is something that you can bring up in a clinical setting. There's something for which there are medical and behavioral options, sexual function and changes of sexual function with age. There are medical options. There are other types of therapists, sex therapists, physical therapists, who deal with these problems and whom can be found in your community. There's lots of information on the internet. So don't just say, oh, well, I'm getting older, I have to live with this. It's important to you as a woman. It's important to our maintenance and feeling vital and maintaining and continuing to grow our relationships. And women are entitled to feel good, at any age.
And I think that the message for women is that if it feels awkward, that's okay. It may feel awkward to you. Yeah. Unlike men's sexual health, which is all over, advertisements, media, it seems to be so much more mainstay. Make this important for you, put it on your agenda, and then bring it to your healthcare provider.
Absolutely. And if everybody feels a little embarrassed, it's fine. You can acknowledge the embarrassment that you may be feeling, and that breaks the ice for everyone. You could say, I know this, I'm not, this may be a little strange, or I'm feeling a little awkward about it, but there's something really important to me that I'd like to bring up. And I'm guessing you'll get a good response or a good reception, especially when you show that you're taking kind of a big step. Your clinician's going to respond positively to that.
And I think the other word of advice is don't bring it up at the end of the interview, just as your healthcare provider is exiting. Make sure you bring it up at least at the beginning of the interview to give your healthcare provider an option to say, this is important, maybe we need a different time, but at least bring it up.
Yeah, no, I think bringing it up at the beginning, no clinician likes like a laundry list with 15 things on it, but a discrete, good, solid list of 3 to 5 things that you want to mention at a visit, top 3, make it in the top 3, bring it up at the beginning, ask, is this something that you do, or can you send me to someone? Don't put them in the position of having to squeeze it in when all the other priorities have been addressed. Absolutely, I think that's a great way to approach it.
Thank you so much.
Okay, good.